So we're at 30 Houston Square and we're preparing for the first Wired Health Conference. Health is a really interesting area right now in terms of disruption and innovation that is going on. Usually when you talk to innovators, they'll pitch you ideas like, I have the Instagram for video, I have, the new Facebook for whatever. These innovators are actually fixing your health and fixing the broken healthcare system, which is relevant to any of us.
Talking to individuals who are actually at the sharp end, at the coalface, is critically important. And I think that dialogue between all the various sectors will, help us do a better job.
To boil down the very best, the most impactful ideas and projects going on in the whole of healthcare into one day is certainly a challenge.
So a key area in ophthalmology is clinical ophthalmology must understand that the eye not only provides us with our sense of space, but also our sense of time.
Can we use chemicals to detect disease? The idea actually goes back to the ancient Greeks.
Someone in the world develops Alzheimer's disease every 6 seconds.
We deserve to have our data collected, shared and analysed in the most unbiased and the most efficient way possible.
We're presenting data showing how information can make you sick, but we're using a specific type of information, that's volatility in the financial markets.
We have a brain and plants don't, because if you don't need to move, you don't need a brain.
So we're about to see the deprofessionalization of public health, and it's called Citizen Epi. And I, for one, are probably the early members.
It's not data versus care, it's data and care. It's not developed economies versus developing economies, it's both.
I've worked in healthcare diagnostics for over 20 years, and in my experience, most emotional times tend to be when people have the least information.
Positive possibilities are more likely for them than negative possibilities.
We will create a bio-API, a way of interfacing the DNA with the binary code and shoot that into the cloud.
While the cure is definitely the aim and was the overriding ambition, the balance was that people need to live as well as they possibly can today.
It's never about what you have to offer or you want to build. It's always about what is it that people need.
And what we do is we combine the kind of technology and techniques we use in elite human performance science to optimize people's outcomes, both in complex chronic disease and in elite sport.
You go to your Kindle, you buy a book, and Amazon takes you on a digital e-commerce journey, a drug to Proteus. You go to your Samsung tablet, you check on your mum's heart failure, and we take you on a digital health journey.
We want indiscriminate, continuous, multi-source data streams to really realize the global health impact and great potential of digital health.
We're still very early in this space. I've heard people say, oh, wearables, a very crowded space. That's like saying in 1997, the internet is really crowded, there's a lot of websites.
The reality is if you live on less than $4 a day, like these three men in Jaipur, there are very few options for a prosthetic limb.
For our main expertise, and which we working hard to it, making synthetic material based on nanocomposite.
I'm looking for the technologies that aren't robotic, that aren't surgical, but that we can pull onto this platform and really fundamentally affect patient outcomes. And that will revolutionize surgery.
Scientists find the gene that makes you fat. It actually isn't the gene that makes you fat, it's the eating that makes you fat.
Tracking our health and wellness data is going to become a normal part of everyday life. And what that data does, excitedly, is give us the opportunity to build types of intervention that we've never before in human history had the opportunity to even consider.
I'm a science editor. I'm amazed every day with the stories I encounter in healthcare. I wish this conference could last for 3 days.